A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant development nearly 5 years after the onset of the COVID-19 pandemic, a Republican-controlled congressional subcommittee has released a comprehensive report suggesting that the virus likely originated from a laboratory in Wuhan, China. This conclusion comes after a 2-year investigation that delved into the origins of the virus, which has impacted millions of lives globally. The report, which spans 520 pages, argues that the evidence increasingly supports the lab leak hypothesis, a theory that has been the subject of heated debate since the early days of the pandemic. The subcommittee's findings, articulated in their final report, state that COVID-19 most likely emerged from a laboratory in Wuhan. This assertion is bolstered by claims that the virus possesses biological characteristics not found in nature, indicating a potential artificial origin. Furthermore, the report highlights that all COVID-19 cases traced back to a single introduction to humans, suggesting a lab-related incident rather than a natural spillover from animals. Dr. Robert Redfield, former director of the Centers for Disease Control and Prevention, CDC, under the Trump administration, has been a vocal supporter of the lab leak theory. He faced significant backlash for his stance, but has remained steadfast in his belief that the evidence points towards a laboratory origin. In an interview on NewsNation's Cuomo, Dr. Redfield discussed the implications of the report and the importance of investigating the origins of the virus thoroughly. The subcommittee also scrutinized the public health measures implemented during the pandemic, such as social distancing and mask mandates. Their findings suggest that these measures were not adequately supported by scientific data. Notably, the report mentions that during closed-door testimonies, Dr. Anthony Fauci, a central figure in the U.S. pandemic response, admitted that the guidelines for social distancing sort of just appeared. This revelation has sparked criticism regarding the scientific rigor behind the public health policies that were enforced. Moreover, the report casts doubt on the effectiveness of masks in preventing COVID-19 transmission, stating that there is no conclusive evidence that wearing masks protected Americans from the virus. This statement is particularly contentious, given that mask mandates were a cornerstone of the public health strategy aimed at curbing the spread of the virus. The implications of the pandemic have been profound, with long-lasting effects on American society. The report notes that the measures taken during the pandemic led to skyrocketing unemployment rates and significant educational setbacks for children, who are said to have lost decades' worth of academic progress. These findings underscore the need for a careful reevaluation of the policies that were enacted in response to the pandemic. As the investigation into the origins of COVID-19 continues, the report's assertions are likely to reignite discussions about the role of the Wuhan Institute of Virology, where researchers reportedly fell ill with a COVID-like virus in the fall of 2019 prior to the widespread outbreak. The lab, known for its research on SARS, has been at the center of scrutiny due to its history of conducting gain-of-function research at biosafety levels that some experts consider inadequate. Initial speculation regarding the origins of COVID-19 pointed towards wet markets in China, where unsanitary conditions and the sale of exotic animals raise concerns about zoonotic spillover. However, the subcommittee's report shifts the narrative, emphasizing the lab leak theory as a more plausible explanation for the virus's emergence. This report is expected to have significant political ramifications, particularly as the 2024 election cycle approaches. The findings may influence public opinion and shape the discourse surrounding the federal government's response to the pandemic. As investigations continue, the call for transparency and accountability in understanding the origins of COVID-19 remains paramount. In conclusion, the revelations from the Congressional Subcommittee's report on COVID-19's origins and the efficacy of public health measures have reignited debates that have persisted since the pandemic began. With mounting evidence pointing towards a lab leak and criticisms of the scientific basis for health guidelines, the path forward requires careful consideration of both the origins of the virus and the policies implemented in response to it. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.